Fighting for funding to support new parents. State member update. By Nicole Werner, MP.
Earlier this year, my husband and I were thrilled to welcome our first baby to our family. We had a wonderful midwife who supported us at our local public hospital through the midwifery group practice program. As all new parents are, we were also supported by a beautiful maternal and child health nurse who provided us support through the early weeks as new parents. It was through the local maternal and child health service that we also accessed support through the sleep and settling programs most local councils offer. As all parents can attest, sleep deprivation is one of the most brutal parts of having a newborn. That is why the sleep and settling programs are a lifeline for parents who are tired, anxious, and trying to do their best. The program sits within Victoria's Universal Maternal and Child Health Service. It provides families with evidence-informed guidance on infant and early childhood sleep from birth to school age, delivered by qualified maternal and child health nurses, using a consistent statewide model of care. From July 1, 2025, the state government stopped funding the group education part of this program across Victoria. Councils were told in late May, which gave them about 6 weeks' notice. That decision has already led many councils to have to make the difficult decision to cancel their group classes, due to simply not having the funding to continue running them. In Manningham, council officers told me they've had to cut group sleep and settling sessions from 3 per week to 1. That is a 2/3 reduction in the service designed to keep families out of crisis. The timing of it made it worse. The state's decision landed while Manningham Council was finalising its budget, so there was no realistic way to reallocate funds in time to keep the program whole. Manningham Council stated it was extremely disappointed and says that the state has effectively treated group sleep and settling as a non-core service. They also report there was no consultation before the change. The short notice put them in the position of informing parents that classes were stopping, which inevitably made it look like Council had cut the program, even though this was a decision made by the state government. Manningham Council has made it clear that this is not the right place to find efficiencies. The cuts do not feel targeted or well judged. They land hardest on first-time and vulnerable families, and they shift pressure onto other parts of the system that are already stretched. I stand with Manningham families and our maternal and child health nurses in calling for the group program funding to be restored so we can rebuild from 3 sessions a week to the level of support our community actually needs. Recently, I asked the Minister for Health in Parliament why these cuts were made, including their impact on our electorate. As I said in the chamber, any new parent knows sleep deprivation is brutal and the mental health impacts are real. These services meet family at their most vulnerable and help prevent problems from escalating. This is a modest, targeted program with a big impact. Councils report they were encouraged last year to plan for ongoing service delivery, then received only weeks of notice before that change took effect. That is not how a true partnership with local government should work. And unfortunately, it is local families who are the ones who lose out. My request is straightforward. Reinstate funding for group sleep and settling education so families in Manningham, Nillumbik and across Victoria can keep accessing timely, practical help. Give local councils proper notice of any changes and work with them to strengthen prevention, not weaken it. Good government sets clear priorities. Supporting babies, parents and the people who care for them should be one of them.
Nicole Werner is the member for Warrandyte in the Victorian Legislative Assembly.